To solve the prioritization questions in the NCLEX, do you know the difference between the keywords? The one you have to solve any different type of prioritization in the exam. Now, when I say any, let me tell you, the prioritization is actually divided into three different categories as per myself. To make it easier, I'm only going to discuss first type of prioritization today. The next two different type of prioritization I'll discuss in the next video. Okay, so the first type of prioritization which we gonna talk about it today is when you have the same patient, same client in the question, and you do have four different nursing interventions or assessment or options, whatever you want to call it, and you're not quite sure how to pick up the right answer for that type of question, right? So it's the same patient. The first I'm going to talk about it today. I'm not talking about prioritization with the four different clients. That will come in the next video. Okay, so if you're new to our channel, I highly recommend it. Subscribe to our channel for more tips, more strategies, more guidance like this, which can help you to pass the NCLEX RN exam. Now, back to the first type of prioritization which I'm going to teach today is the when you have same different type of patient and you do have four different options. It's not a static question again, it's a four different patients, okay? Now, how to handle that type of question is there is a keywords behind it. They either asking you initial, best, priority, first, next, essential, those type of words. Now remember, every word has its own meaning, okay? To elaborate more in detail, definitely I'll make a one detailed video in the future as well, but I'm only going to tell you today a one little tiny difference between the priority and the best, okay? So if we talk about the priority and the best, so the priority means first, right? So what you will do first. Now, if you do have four different interventions or options in front of you, even including the assessments, you can do everything maybe in there, but you really need to ask yourself, what do you want to do first if something happened like this in the question, right? So let's take an example. Maybe the example is you have a client in front of you who is feeling like shortness of breath, right? So now if someone is feeling shortness of breath, what you will do first or priority, right? Intervention or nursing action in that case. Well, let's say you have two options now where you got stuck and the other two options were irrelevant, maybe you eliminated already, right? So the two options maybe you got stuck, you have give oxygen, and the second one maybe you do have positioning, right? Maybe let's say semi follows position or high follows position is written there and it's relevant as per the client in the question, and you're confused in those two options, so you're not quite sure which one is the first and priority answer, right? So the first answer will be, you ask yourself, do you want to apply the oxygen first before positioning, or do you want to do positioning first before oxygen, right? So the answer for the priority for this question will be, you want to do positioning first before you put the oxygen, until unless if it's not a contraindicated positioning, right? So positioning because you want to expand the lungs of the patient, and then you want to put the oxygen on it, right? Now, the second type of scenario, if I tell you the difference with the same scenario, the difference between the priority and the best. Now the same scenario, same question, if I ask you which one of the following will be the best action or the best nursing action or intervention or implementation, whatever you want to call it, right? So if it says best, best means something you have to do it in there, right? So now try to understand, the initial you do the position first and then you put the oxygen, but if it's saying the best, for the best, you want to do that action which you have to do it, right? You can forget about the other, but you cannot forget leave the other option which you think you have to do in that case, right? So the best action will be for the same case will be oxygen. Even if you forget to do the position, well, we do understand the patient will not get 100% oxygen by not giving the positioning first, but you still have to put the oxygen at the end of the day, right? So this is just a sample, like an example I'm choosing today, just to make you feel easier understand what is the difference between the first or priority and the best type of questions, right? So I hope this little tip will be helpful for you, right? And definitely, as I said, even in this first type of prioritization, there's a lot of keywords, right? And every keyword has their own meaning, like next, essential, most important, like emergent action. Like every keyword has its own meaning, like for the same question, right? So if you want to learn more about the keywords or strategies, for that, please don't forget to like the channel, okay? Because the more videos will be uploading soon in the future nearby, and you can learn something out of it. And I hope this little tip was helpful for you. And if you do have any general question for us, feel free to give us a call today with the number given below in the description. Thank you.